Hello, this is Mary Gavoni. Welcome to Face Masks Are Your Friends. And for those of you that are laughing by the choice of title for this webinar, I sincerely mean that. We're working in an environment in dentistry right now where we have some serious respiratory issues that we need to protect ourselves from. So I want to give you just a very brief background about who I am, what I do, and then we'll get right into the heart of our topic for tonight. I have been an OSHA infection control compliance consultant since 1992. Previous to that, I was a chairside dental assistant. I managed a dental practice. I was an educator in a dental assisting dental hygiene program at the community college level. So I've been around the block a few times, interacted with lots and lots of dental teams, both in offices and presenting seminars all over the country and internationally to some extent as well. And I'm still amazed that all these years after the implementation of the bloodborne pathogens standard, that there's still a lot of folks like myself still working in dentistry that still kind of don't have things right with face masks. And then we have new people coming in that also maybe have some misinformation or just decide that they want to kind of do things the way they want to do them. And respiratory protection is not something to play around with. So let's get on with the show. But before we do, I want to acknowledge our sponsor for this evening, which is Medicom. And we're going to talk a little bit about some new types of face masks that they have available or will shortly, and I think there'll be something that you'll really like. But before we get started, I want to play you just a short video clip. This was done at the Greater New York meeting a couple of years ago, and it sort of sums up a lot of the things that we're going to talk about this evening.
This is the wrong way to wear a mask. Don't do this. What's the right way? I'll show you. So what are some of the things that dentists and hygienists and assistants are doing wrong with their facial masks?
So dentists and hygienists don't necessarily know how best to use the mask. And so they'll often wear their mask inside out with the color facing in, and the color is supposed to be on the outside. So it's important when you're putting on the mask to have the color facing out, and you want Medicom. You see, Medicom has their brand on the bottom, so you want that to be on the bottom. You want the nose piece on the top, and that on the bottom.
Okay, perfect.
Because of the way that the masks pleat, if they're worn backwards, you'll get gaps on the side.
So color out, number one.
Color out. Another thing is the way that they put on the ear loops. So sometimes they'll cross the ear loops, like so. And pink is not my best color.
I think it looks smashing on you.
Right. So this is how you're supposed to wear the ear loops.
Right.
But sometimes you'll get, for tighter fit, clinicians will go and cross the ear loop over, but that causes gaps on the side. So those are some of the things that
don't cross the loops.
You don't want to be doing. And you definitely don't want to be wearing the mask for too long or in between patients. Sometimes clinicians will what they'll do is they'll be wearing the mask and they want to go out of the procedure room. They'll pull it down below their chin, and then they'll come back and they'll pull it back up. And that's definitely a no-no. Cross-infection, cross-contamination can happen
for sure,
very easily.
I've seen a debate recently online where dentists were saying, oh, I use one mask for 3-4 patients. They change it just kind of indiscriminately at some point when they feel it's getting dirty or something like that. I change my mask between every single patient. That would be the advisable way to do it. Yes?
That's right. So, and if you are in a procedure that's a little longer, you'll want to change your mask when it's difficult to breathe through, because that means that your mask filter is saturated and you're no longer filtering out the bacteria. So if you're having difficulty breathing through a mask, you know that it's time to change it. And if there's any splash, so if you get splatter or splash on the mask, even if it's after 10 seconds, you definitely want to be changing.
It's in your own best interest to do that.
That's right.
Yeah. Now I have an age-old question. How do we prevent fog on our glasses and on our loupes?
That's a good question. So you want to make sure you're using a mask that has a very strong nose piece. So often imported masks or cheaper masks will have these sort of twist ties that are used as opposed to an aluminum nose bar. The best quality is the ones with the aluminum nose bar. That will give you the best fit, and you need to make sure you're pushing down on it and molding it to your face. That'll give you the best airtight seal.
I'd like to put this mask on, and can you grade me to let me know if I've done it correctly?
Sure, so you might want to use a
different one. That was a test. Thank you very much. Okay, here we go.
Maybe pink will look better on you.
I'm going to see. It's my color, I've been told. Here we go. How'd I do?
So pretty good. You want to push along your cheeks.
Oh, like really get the whole area, so not just the nose.
Right.
I find this helps me with the fog. If I pinch down here, it's usually not a problem. But also do a little one of these.
Right. Make sure that you're...
Okay, so we're going to pause this there in the interest of time, but I think you get the gist of some of the issues of wearing face masks and what are some of the issues that people encounter when they wear them correctly and incorrectly. So tonight we're going to talk about 4 key topics. Number 1, we're going to review the regulatory requirements for wearing face masks, who says what we have to do. Then we're going to review the different types of face masks and how we should be selecting them for different procedures. And I'll give you some of my personal experience and personal opinion on that particular topic. Then we're going to discuss characteristics of face masks and how those characteristics factor into how we select them in terms of brand and level of protection and so forth. And then we're going to finish up troubleshooting issues with wearing face masks and how we can make it a better experience and truly make the face masks our friends. So let's start with regulatory issues. And this is a quote directly from the OSHA Bloodborne Pathogen Standard, which says that masks, eye protection, and face shields, or masks in combination with eye protection devices, such as goggles or face shields, shall be worn whenever splashes, spray, spatter, or droplets of blood or other potentially infectious materials may be generated, and eye, nose, or mouth contamination can be reasonably anticipated. So the interpretation of that, of course, then is anytime you're going to use an air water syringe, a handpiece, an ultrasonic or some type of a mechanical scaler with a water spray, then you need to be wearing a face mask, respiratory protection. Now, there are also issues under the bloodborne pathogen standard, but I'm focusing tonight on infection prevention. Under the hazard communication standard, if you're going to be exposed to dust or mist or fumes from materials or things that you're working with, cleaners or perhaps lab stones, some of those types of things, then you also need to be wearing respiratory protection. But again, we're focusing on infection prevention. And I mentioned earlier that we're in an era of some challenging respiratory issues in dentistry. Number 1 is we're coming into now the beginning of the flu season, and it's starting earlier this year than it typically has. We're seeing outbreaks of flu already. We also are hearing predictions from the Centers for Disease Control that it may be an extended flu season. So that then increases the potential for us to be exposed to patients who may have the flu. But the other issue that we're dealing with are the huge outbreaks that we've had around the country with patients infected with measles. Now, many people believe that measles is simply an infectious disease that has this skin rash component, that if you touch it and then touch your eyes, nose, or mouth, you can become infected. But measles actually is a respiratory disease. And so you can be exposed to measles from someone who is infectious through their respiratory secretions. So coughing and sneezing, and certainly production of aerosols in a dental setting can cause an exposure. And what's come to light in all the information that's been disseminated because of the measles outbreaks, we now know that the measles virus can remain in the air, airborne, in a room for up to 2 hours after someone who's infectious has been in that room and has been coughing or sneezing or perhaps having dental treatment. And those patients who may be infectious with measles are infectious as many as 2 days before they actually break out in the skin rash, which makes it very obvious to us. So you might not know. So respiratory infection is critically important for us at this point in time because many adults have decreased immunity to measles and may need to be revaccinated. And you need that respiratory protection. You certainly don't want to contract measles from a patient in your practice. So now we go to the CDC. The directives we have from the CDC for infection control in dentistry are still in many cases called guidelines. And some people believe that because they're guidelines, they're voluntary, we don't have to follow them. But in most cases, dental regulatory boards, boards of dentistry, boards of dental examiners have adopted CDC guidelines as the patient safety standard. Remember, OSHA covers employee safety. CDC covers patient safety and also employee safety to some extent as well. So even though we call these guidelines, they are the standards of care and we need to be following them per the rules for practicing dentistry in whatever state that you are in, or if we have friends from Canada for the provincial guidelines as well. So CDC says that the use of mouth, nose, and eye protection during procedures that are likely to generate splashes or sprays of blood or other body fluids. And for us in dentistry, that is typically saliva. So both OSHA, both CDC say when we need to wear respiratory protection. Now, there's a couple of other agencies that you may not be as well aware of, and this applies to the US, it applies to Canada, and it also applies to other organizations outside of those two countries, because the first organization, the American Society for Testing Materials, or ASTM, is actually an international organization, and what they do is set product and testing standards for various materials, personal protective equipment for lots of different devices. And ASTM works very closely with the American National Standards Institute, or ANSI, which is the organization recognized in the US by OSHA as the requirement that personal protective equipment must meet. So in other words, if you are wearing face masks or safety glasses, they must meet, by OSHA requirement, ANSI standards, and ANSI then looks to ASTM to test and make sure that the standards are being met. So that's sort of a long, convoluted, twisted explanation of how these agencies affect us, but something very important. So if you're purchasing face masks, for example, you need to look on the package, look on the box, and make sure that there is an ASTM designation on that box that tells you what level of protection you are buying. So if you're buying them from your dental dealers, most likely those that designation is going to be on the face masks that are sold. If you're buying them online through Amazon, for example, then you may be getting masks that are manufactured in countries that don't recognize ASTM or ANSI standards testing. So be careful. It's buyer beware with face masks, and you don't want to skimp on your personal protective equipment. So we have an audience participation question now, and you can just select one of these options from your computers. Do you know the ASTM level of the masks you wear every day? We'll give it just a few more seconds for people to be able to answer. I know we have lots and lots of people on our Okay, so I'm going to close the poll and I'll share the results with you. Which is sort of interesting, I think, that a great number of you, the majority of you, don't know the ASTM level of the mask that you're wearing. You wear what's supplied to you and what's in the supply cabinet, and that's what you do. So I think that this is very important for us then to look at what do these ASTM levels mean, and how can you make a better selection to keep you safer? So there are 3 ASTM levels of face masks: low, moderate, and high barrier. And so you can see there are groupings of procedures that are recommended by ASTM and by ANSI for wearing during dental procedures. So if you look at level 2, for example, restorative / composites, you notice they don't say amalgam, but there's a study that was just published not too long ago about removal of amalgams, which leads me to believe that I would put restorative procedures, especially if we're removing, down into the high barrier category. But endo, prophy, that would be hand scaling, sealant, scaling and root planing, some oral surgery procedures. A lot of practices wear level 2 masks routinely. High barrier masks, crown preps, implants, use of an ultrasonic scaler, a piezo scaler with water, perio surgery, complex oral surgery. Anything that creates a high level of aerosol when you're doing a procedure requires a level 3 face mask. And I didn't mention the ASTM low barrier face masks, although you could use them for operatory cleaning and some other things. But here's the deal. I think the more choices that people have for face masks in the office, there are 2 things that will happen. One is we're probably going to go to the lowest common denominator with most face masks, because if I wear a low barrier face mask, I can breathe easier and I'm going to like that one better. It may not give me the best protection, but if I'm not understanding the risk, then that's where I may go. If I have to select between a 2 or a 3 when I'm doing another procedure, again, I'm probably going to go to the lowest common denominator. And again, I may not be using the right thing. I tell the practices that I consult with, use level 3 masks, unless you have an employee that maybe only works in the laboratory. For example, in an orthodontic practice, they don't work with patients. They only work in the lab making appliances, or perhaps the entire orthodontic practice could wear a level 1 or a level 2. But other practices, I would say, have level 3s, and that's all we wear, because then we always have the maximum protection. And I see we have a question about how can you tell on your box of masks. And as I mentioned earlier, you need to be checking your box of masks to see if it has the labeling on it. It should be right on the package, or perhaps it's in a package insert. But in most face masks that you purchase from your dental suppliers will say ASTM, or they'll just say a level 1, level 2, level 3 mask. If it's not on the box, if there's nothing to indicate, then perhaps that's not a brand of face mask that you want to choose, because you really don't know what kind of barrier protection that you are getting from that particular face mask. So we have those categories, 1, 2, and 3, and now we have another question for you, another audience participation question. And the question is, do you know? No, that's the question we used last time. So, Trung, let me see if I can figure this out and see if we can get the right question here. Ah, there we go. Now, technology is not my friend tonight necessarily. Okay, is it acceptable to reuse face masks from one patient to another? And I'm not taking names, you can be honest. And if your answer is the third one, I do it regularly, that's okay. It's not the best because you're not following guidelines, but I'm not taking names and reporting anybody. Okay, so it looks like everybody's pretty much weighed in. And great, this one is very encouraging to me, that 93% of you who participated in the poll say that it is not acceptable to reuse face masks from one patient to the other. And that is absolutely the right answer, but we see it happen all the time. One of the things that I see, not only in practices, but I also see it happen in the media. I see ads for products, or I see images that represent dentistry, and everybody's got their face mask scrunched underneath their chin, and that is not how we wear a face mask. So there's two groups that weigh in on this particular issue, because some of you may want to know, well, who says I can't reuse my face mask? There's two things. One is the Food and Drug Administration, and the Food and Drug Administration clears or approves of different devices that are used in medicine and dentistry. And many of the items that they clear, meaning they've tested them for efficacy and for appropriateness and so forth, many of those items are approved or cleared as single-use or disposable items. Anything you purchase that has this symbol, the 2 with the line drawn through it, means you do not use it more than once. It's disposable. And the Food and Drug Administration says if something is a single-use device or disposable, it's intended for use on one patient during a single procedure. It's not intended to be reprocessed, and there actually is no way that you could reprocess or clean or sterilize a face mask. So yes, I understand that that is an expense, that using a new face mask on every single patient incurs for practice, but you absolutely need to follow these particular guidelines. The thing that we need to be aware of is not only in the US, but in Canada as well, regulatory boards are beginning to audit dental practices. And the reason that they're auditing practices, meaning inspecting them, is because there have been so many infection control breaches reported in the media in the past several years, going all the way back to the instance that happened in Oklahoma with the oral surgeon that potentially exposed up to 7,000 patients because of improper sterilization procedures. So if you are not following appropriate guidelines from CDC, appropriate use of disposable items, then that's a risk management issue for your practice. It wouldn't necessarily be something that OSHA would look at because it really borders more on patient safety than it does employee safety, although certainly we want good respiratory protection for employees. But it's not likely that OSHA would come and inspect you unless there was a complaint. But dental boards have the right to come and audit or inspect practices, whether they have a complaint or not. They just have the authority to come and see how things are being done, how patients and the public safety is being protected. And if you are not following those rules and guidelines, then a dental board actually has the authority to shut your practice down. And we've seen that happen both in the US and in Canada. So we need to be very careful, and not just about respiratory protection, other items. If you have suction tips, for example, that maybe are made of a material that can withstand heat sterilization, or perhaps you're putting them in a high-level disinfectant, what we used to call cold sterile, that if that item is labeled as disposable, then that is actually a violation of Food and Drug Administration laws. So be careful about reuse of disposable items. Change your face mask, change your face mask, change your face mask. And if you remember from the video, there was a statement made that said, if your face mask becomes wet, there's so much spatter or splatter or aerosol, then even if it's only been on you for 10 seconds, you need to change that face mask, because once it becomes wet, then it can actually wick in contaminants that you may then breathe in. So changing face masks is critical. The other problem with taking your face mask, perhaps that you've used on a patient, there's spatter or splatter contamination on the outside of that face mask. If you push it down under your chin, it's very possible you may have put that contaminated side next to your skin. If you put that face mask back on, you certainly don't want to do it with bare hands, because now you've contaminated your hands. If you do it with a glove, now you've contaminated your gloves. And so because we don't wash gloves, you would need to re-glove if you were doing the wrong thing and reusing that face mask. So let's take a look now at some other characteristics and factors that we need to look at for face mask selection. There are three key things, not the only ones, but three key things that I think are really critical for you all to look at when you're making selections for face masks. Number one is fluid resistant. Fluid resistance. How well does that face mask prevent or minimize fluid from traveling through it and coming in contact with your eyes, nose, or mouth? Next is bacterial filtration rate, and it's the efficiency of the mask in filtering out bacteria from passing through the mask. So viral particles are so much smaller, many of them may pass through the mask, but we're looking at bacterial filtration here to make sure that we're getting the smallest particles that we can filtered out, and that would include some viruses, okay? Then we look at particle filtration rate. We certainly don't want other types of particles being drawn through the mask. So we look at that measure as well. So taking those characteristics and then partnering them or attaching them to the ASTM levels, then if you look at this matrix, you can see why level 3 masks make the most sense. Now, this measure of 160 millimeters of mercury is the fluid resistance rate for level 3 masks. Contrast that with the fluid resistance rate for a level 1 mask. It's half for a level 1 mask. So you have a 50% reduction. You've got about a 20% reduction from level 3 to level 2. That is a big factor for you, because anytime you have fluids, they may have bacteria, viruses, other particles attached to those fluids or contained in those fluids. And so we want the most fluid resistance we can get in a mask, but the more fluid resistant it is in many cases, the less breathable it may be. So I know that's what everybody hates about many of the face masks. I can't breathe in them. For example, if you were treating in an emergency a patient who you suspected had infectious or active tuberculosis, you would wear something beyond the ASTM level. You would wear an N95 respirator, and that has an even higher fluid resistance rate, and it's very much not sort of user-friendly in the breathability standpoint, but that's a different kind of a situation. Other than that, if we look at the bacterial filtration rates for all the different levels, they're not that much different. Same thing with particle filtration rates. So this, I think, from a usability standpoint, is really an important thing for you. What's the fluid resistance rate for a face mask? And that's where I would go with a level 3 mask. And here are my favorite instances of what we shouldn't do with face masks. The most common thing that I see in practices is this and this. And a lot of times, I hate to be sexist, a lot of times it's the women. We get hot, we get uncomfortable, and so we put that face mask on, but not quite all the way up over our nose. So you're really not getting all the respiratory protection that you need. I see people putting them on just underneath their chin, so they're not even covering their nose or mouth, and then you're getting no respiratory protection at all. So make sure that you are placing it over your nose. And yes, I do know, because I'm sure somebody is going to say, ooh, they're wearing short sleeves, and they are. That's not OSHA compliant, but I'm looking at the face masks here. And we have a question that I think is a good one. Is wearing personal protection for patient or doctor protection? And it's both. It is actually both. It is protecting the patient if you happen to have some type of respiratory symptoms, but it is also for the doctor or the team assistants, hygienists, to protect them from the aerosols and the spatter splatter that's created during treatment. So we put it all the way up over the nose. This is not necessarily a good fit on this particular face mask because it gaps. And here's another example of gapping because the ear loops are crossed. That's an inappropriate way to wear a face mask. And again, here we are. Now, this may very well be a situation where this person hasn't actually started a procedure yet, so they haven't used this mask. But a lot of times, and this happens to be a tie mask, it's just put down around the chin. So not appropriate to do. And we have a question about, if you wear a face shield, can you use a level 1 mask? And the answer to that is no. And it depends on the procedure that you're wearing. OSHA will say that for employee protection, if you wear a face shield, you must wear a face mask. But remember the ASTM levels that we looked at previously. say that it's procedure dependent, not dependent on what type of eye protection you're using. So level 1 masks are appropriate for orthodontic procedures or laboratory procedures, but if you're doing restorations, you're doing oral surgery, you're doing ultrasonic scaling or prophy, then you need a level 2 or a level 3. That's based on the risk of the procedure. It's not based on the eye protection. We have another question about magnifying glasses that I will answer at the end. I just don't want the asker of the question to think I'm not responding to it. Now, here's another thing that we see a lot. This lovely model here wearing a face mask that is upside down. If you notice the direction of the pleats in many types of face masks, they don't have a sufficient barrier built into them that will stop anything that pools down in these pleats from getting through the face mask. So if you're using a face mask that is not a Medicom safe mask, then this is inappropriate. That is upside down. You need to turn it up so the pleats are facing down. And then I'll explain a little bit more about that in a minute, because I don't want to confuse anyone. So here's the objections that I hear, and many of you may have even more that you will say about how much you hate wearing face masks. Difficult to breathe in them, makes us hot. And by the way, I hear from dental professionals all the time saying, well, I just put a fan in my treatment room. That is not acceptable, because if you put a fan in the room, what you're doing then is circulating over a wider area the contaminants in the air from the aerosol. So fans are not allowed. And I know that many times people hate that the air conditioner gets turned way, way, way down and the patients are freezing. We can give patients blankets, but we need to keep it cool enough so that we're comfortable in our personal protective equipment. Hear lots of complaints about fogging, and that has to do a lot with either the breathability of the mask and or the type of nose piece that's on the mask. If you remember from the video, some of the cheaper masks will have a very low effective barrier or a piece at the nose piece at the very top that doesn't give you a good seal. So you want to look for a face mask that has something that's aluminum or something that's flexible that goes almost all the way across the top of the mask. So once you secure that to your face, you will have less fogging of your safety glasses. You also can run your safety glasses under warm water before you start your procedure so that they will be at approximately the same temperature as your body, and then you'll get less fogging too. Skin irritation used to be a very, very common complaint about face masks, and more manufacturers like Medicom and Crosstex and others are coming out with face masks, or have introduced face masks that have very, very soft material, no scratchy fibers, no dye on the inside. And so there's much less skin irritation that happens with face masks. Some companies even have a mask that's branded as a sensitive skin face mask. I also hear that face masks don't fit well. And I think part of that is that the face mask isn't put on correctly, and so it's not stretched out appropriately. Perhaps there isn't something under the chin that can help to secure the mask underneath your chin, and or the ear loops are crossed. Now you'll notice I haven't talked at all about molded face masks, and that is because most of the molded face masks that are on the market today do not have an ASTM rating. So they are not considered to be adequate barriers for dental procedures. So if you need to wear a molded mask, some people with hearing aids, for example, someone who wears a headscarf when they're at work and they can't easily use an ear loop mask, like to use molded masks, but you need to make sure that you have one that's got an ASTM rating of at least level 2 or level 3 for most procedures. So the bottom line here is that if you make the right choices for the types of face masks that you're using with your patients, then you should overcome a lot of those barriers. Number one, and I've talked about this already, use the correct ASTM level according to those categories of procedures. But again, I don't like having too many choices because it increases, I believe, the possibility for errors. That, again, most people are going to go to the lowest common denominator. They want the one with the most breathability, and if we only have one and it's the incorrect one, then all bets are off. Now, I don't know how well you can see this on your screens, but right here on the top right-hand corner of this package of masks you see, it says level 3. That's how I know what type of protection I'm getting from this particular face mask. So again, we're going to look for good breathability, anti-fogging nose piece, dye-free on the inside so color goes out, and soft, non-irritating material on the inside. And again, I'm not sure how well this shows up on your screen, but on this particular face mask, this is a brand new face mask from Medicom called Free Flow, and it's a special design that has a structure built into it that is like an airspace once you've deployed the pleats on the mask. And so it makes better breathability for you, but it also then doesn't allow pooling in the pleats, no matter which way you would put it on, although you obviously want the nose piece on the top. But even though some of the pleats might be facing up, if anything did pool, it won't get through the barrier. So this particular mask, although it's not the only one you have to choose from, it's designed to overcome the objections that we just talked about. That's uncomfortable, it's hot, it fogs up my glasses, all the things that we don't like about face masks. So I would encourage you to research this. Talk to your dealer reps when they come in to visit you. Go onto the Medicom website, medicom.com, and do your own research and product research, and look at other brands of face masks as well, because you do have lots of choices. But I really, really like this particular face mask because I think it answers so many of those objections that we have that make us do the wrong things with our face masks. So we're going to spend some time now. We're a little bit ahead of schedule, which is great. So we're going to spend some time answering some more questions. If you haven't submitted one already, please take some time to submit a question. One that someone posed before was about how do I treat my magnifying glasses between patients? And I'm not sure exactly what type of magnifying glasses, but it really shouldn't matter so much, other than scopes are a little, or loops are a little more sensitive. First and foremost, your safety glasses should never be disinfected with a surface disinfectant. So you don't use your surface disinfectant that you use on the countertops and the equipment when you are finished with a patient. You should wash them with soap and water. Be careful with your loops. Follow the manufacturer's directions because you don't want to get moisture into the scopes. But also you have, through a number of companies, you can buy lens cleaners. And the lens cleaners have alcohol in them, and they will help with some disinfectant properties. But if you have a lot of blood spatter, then you've got to at least do a wipe with water to get the blood off before you use a lens cleaner, because alcohol isn't a good cleaner for blood. It actually dries it on a surface, makes it harder to remove. So remember that whether you have plastic safety glasses, whatever you use, soap and water or water to get the debris off, any blood spatter, then use a lens cleaner on them. And always follow manufacturer's instructions for your loupes. Be very careful. You don't want to destroy. So another question about fogging. And again, some of that, it has to do with mask selection. And if you have it sealed well at the top of the mask, pressed against your face, and that's dependent perhaps on the type of mask and the type of nose piece it has on the top of the mask. And if you're wearing a visor, again, what I might do, if the visor is one that you can run under some warm water, same thing with your safety glasses, run it under warm water and let it dry. Do an alcohol wipe, lens cleaner wipe on it to help dry it, so that it's the same temperature as your body. If you're going to wear a tie mask, again, you need to look at the brand of face mask that you wear. So the tie mask has a nose piece at the top that will help to seal for you. Those are a little more difficult to get to seal unless you specifically look at the brand. So if you're going to a dental meeting where you can really go look at lots of different types of face masks, maybe get some samples, contact manufacturers and ask for some samples. I'm sure that Medicom would be happy to send you some samples of their face masks that you can try to see which one finds or gives you the best seal. Another question, how do you disinfect respirators between patients if these are necessary? And the answer to that question is it depends on the respirator. Many, and I'm going to make an assumption here, that you are talking about an N95 or perhaps even an N95 respirator, and many of them are disposable. So you use them once and you throw them away. If it's reusable, you must follow the manufacturer's instructions for how you reprocess those. Okay, let's see, what else? Great question. How do you know which side to use when the face masks are all white? If the face mask is all white, you need to look at, first of all, the instructions that come with the face mask, and they may tell you what to look for. There may be some kind of a landmark on the face mask that tells you which side goes out, but your best indicator is the direction of the pleats. You know you have it on correctly if the pleats are facing down. And that is for masks other than the safe mask free flow. So if the pleats are facing down on the outside of the mask, you know you have it on the right way. If you wear a level 3 mask and loupes, do you still have to wear a face shield on top of those? No, you do not, because your loupes most likely have side shields built into them, and your loupes with the safety glasses count as eye protection. So you don't need to wear a face shield over the top unless you choose to. And another question, if my nose piece is sealed correctly and my glasses still fog up, does that just mean we have very poor face masks? And I don't know, it could be, but the other part of that may be that it doesn't have a long enough nose piece to seal. But again, it may be the brand of face mask as well. So it could very well be. What can be done or who to contact about offices I sub with that do not follow basically everything you mentioned? That is a very sensitive area. First and foremost, if you sub in a practice that isn't following guidelines, you have a choice not to sub there. But certainly you could contact your state board of dentistry, or you could contact OSHA, depending on the types of violations there are. But if someone's doing something so incorrectly and they're not receptive to any suggestions for you, my choice would probably be not to sub there, but tell them why so that they understand why. I think perhaps that we have addressed all of the questions. Unless someone has any other questions, I'm going to turn this over to our host for some final instructions. And you should be seeing those on the screen. Make sure that you are completing your post-webinar exam. You must do that in order to obtain your CE credit. If you have any questions or concerns about completing the exam or getting your CE credit, please contact Viva Learning. I would be happy to help you with that, but I'm not in control of that. If you have questions after the fact about the content of the webinar, you may absolutely contact me. This is my email address, and you may send me questions. I'll be happy to try to answer them for you. Please put webinar in the subject line so that I know you're not a spammer, because I won't necessarily recognize your email address. And if I don't recognize who an email is coming from, I typically don't open it, and neither should you for security reasons. So just put webinar in the subject line. Happy to answer questions for you. But again, if you have issues with the post-exam or the CE certificate, contact Viva Learning and they will be happy to take care of that for you. So thank you all for participating, and I hope to see you again on a future webinar.